So you may have heard about celiac disease and could be wondering, do I have celiac? Well, in this video today, I'm going to go over 4 signs that you actually may have that could be concerning for celiac disease. We'll talk about how to manage those symptoms if you happen to have them. And we'll talk about the long-term damage that may occur if you have celiac disease and continue to ingest gluten. Guys, let's talk about poop. Howdy y'all, Dr. Samir here, aka your poop guru, trying to give you the best tips and tricks to help out with your health. If you haven't already, don't forget to smash that like button, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter. I'll put a link right here where you can get great tips and tricks every single week. Celiac disease, so many questions about this, so many myths, so many things I see on the internet, so many people wondering, do I have celiac disease or not? If you're interested in more information on this, I'll put a link right here. But there are a couple of cardinal signs that allow me as your poop guru to think, I think this patient or this person actually may have celiac disease. Let's talk about them right now. So number one of the most common signs of celiac disease is a really bad rash on your extensions. This is a really red, irritated, itching rash. You just got scratched all the time. The official name is dermatitis herpetiformis. Fancy name, but that actually does have almost a universal correlation to celiac disease. So if I have somebody come to see me who has a really bad rash on their elbows and they've been diagnosed with this rash, a light bulb goes off in my head and I think, I think this person has celiac disease. Number 2 is a family history of celiac disease. So if your parents, your brothers, your children, somebody in your family has celiac, there is a good chance that you could have that disease, or at least have the genes that could make it more likely for you to have gluten intolerance as well. We know that celiac disease is a genetic disease. There's something in the genes that makes it more likely for you to have this problem. Now, just because you have a family history of this doesn't necessarily mean that you have this. It can be a combination of multiple different factors: the environment, genes, food exposure, things like this. But in the right combination, in the right patient, you could have a condition that can make it more likely for you to have or manifest as celiac disease. So if you have that family history, make sure you let me know. Number 3, you have unexplained GI symptoms, weight loss, diarrhea, low blood count, or anemia. These are signs of something else going on inside your GI tract. Now, celiac disease is not the only reason to have this, but it's high up in my thought process of what could be going on. So if you don't understand what's going on with your body, you're having weight loss, your blood count keeps going low even though you don't see any blood, or you're just not feeling good, make sure you get tested for celiac disease. And then number 4, if you have issues with gluten, you may have celiac. Okay, duh, Captain Obvious. But it's very important to realize this because I'll tell you, not everyone has gluten issues, has celiac disease, and not everyone that has celiac disease may necessarily manifest as having gluten issues. It's a very confusing thing for a lot of people. So we actually have a way to diagnose somebody with celiac disease. We do blood testing plus a combination of an upper scope to see exactly what's going on. We do not have ways to test for gluten intolerance. And there's a very important distinction between the two, because ingesting gluten when you have celiac disease can lead to long-term complications, which I'll talk later on in this video. But ingesting gluten in somebody who has gluten intolerance, it'll have gut issues, but it doesn't lead to long-term problems down the road. Very important distinction that we can determine what is going on to see what the next steps are going to be to get you taken care of. So let's say you've been diagnosed with celiac disease. How do you manage those symptoms? Well, step number 1, which is duh, Captain Obvious, is you have to avoid gluten. Now, it's important to avoid gluten in everything, not just in what you eat, but maybe in your lotion, your perfume, your shampoo, your soap. When you're scrubby dubby, there actually may have gluten in that as well. So you have to be very careful and very cognizant of everything you expose yourself to make sure you don't have gluten. Number 2 is to also make sure you don't get accidental gluten exposure. there are people out there who don't realize that they're cooking in an area that has a lot of gluten products that are there, or you have cross-contamination between utensils or even in particular kitchen that can make gluten particles go into your food. So make sure whenever you go out to eat or you eat at home, you really do separate the gluten versus non-gluten food. And number 3, consider getting tested for other conditions. So just because you have diarrhea and you have celiac disease does not necessarily mean that that diarrhea is only due to celiac disease. There are other autoimmune conditions going on like thyroid disease, a colitis called microscopic colitis, small intestinal bacterial overgrowth or SIBO, or even irritable bowel syndrome or IBS. So just because you have one condition like celiac does not exclude you at all from having something else. If you're still having gut issues despite avoiding gluten, get tested for other conditions that could be going on. All right. We talked about gluten, we talked about celiac, but who gives a flip? Who cares? It's not a big deal. Or is it? Well, if you've gotten this far in this video, you know, yes, it is a big deal, especially if you have celiac disease. So keep in mind, celiac disease is an autoimmune condition. Your body is attacking itself. It's getting rid of all the things going on inside your body because you ingest gluten. So the more that you ingest gluten, the more your body is going to attack itself and can lead to long-term complications. Here are 5. Number 1, your blood count will go low. You'll develop anemia. You'll be tired, fatigued. You just won't feel very, very good. This occurs whenever you ingest gluten and it damages the lining of the small intestine. This impairs your inability to absorb iron, which can cause you to become anemic. Number 2, you will start to lose vitamins, very important vitamins like vitamin D, vitamin E, vitamin A, vitamin K. These are important vitamins that we need to help out with normal activity. And if you lose that, this can lead to long-term complications down the road. Number 3, you'll have weight loss. It is not weight loss that you want. You'll not be able to absorb anything. You won't get the nutrients that you need. And just overall, it's going to lead to long-term problems for your health. Number 4, you'll just feel crappy. Oh yeah. I mean, imagine just having weight loss, poor appetite, diarrhea all the time, just not feeling like yourself, just feeling sick, inflamed. This is what happens when you have continual gluten ingestion, is that you just feel like, you feel like crap, and it's not good. And then lastly, number 5, there is a high chance you can develop lymphoma. Continual gluten ingestion in the setting of celiac disease over time will cause more and more damage to your small intestine. Over time, this can lead to a lymphoma called T-cell lymphoma. This is a deadly form of cancer. And unfortunately, I've diagnosed patients with this who didn't heed my advice, kept on having gluten, didn't think anything of it, and over time, they ended up having lymphoma or cancer of the small intestine. I don't want this for you. I want to make sure you protect yourself from any long-term complications from it. These are 4 signs I look for as a poop doctor to see if you have celiac disease, and based on that, we can determine what the next steps are going to be. My question today for you, what questions do you have about celiac disease? Comment down below. I would love to hear what you guys have to say. I want to thank you for watching. Don't forget to smash that like button. Like, share, and subscribe. And if you haven't, and you know you want to, don't forget to subscribe to a weekly newsletter. I'll put a link right here where you can get great tips and tricks for your gut health every single week. Guys, I want to thank you for watching. And as usual, hope you guys have a happy day. And don't forget, let's talk about poop. Thanks, guys. And if you are interested in more videos about gluten and celiac, I have a playlist right here that you can link to and go straight to it.